It was only this year when I went to my OB that I realized that I did not have my annual checkup last year. So when she asked me to get a mammo, I immediately did. This is the result of my mammo taken July 19, 2011. It says here, previous studies reviewed and comparison made. So the diagnosis is, it says so many things: cluster of round, punctate, linear branching calcifications delineated at the left upper outer quadrant. For the assessment recommendation, what is eye-catching here is left, suspicious for malignancy. Needle wire localization under mammographic guidance may be done. The BIRADS category is 4C, meaning suspicious abnormality. Biopsy should be considered. Findings of moderate concern but not classic. Although the results were already available, hindi ko pa siya nakuha kagad kasi nagka-problema sa mom ko, who is 83 years old. Nag-shoot up yung kanyang BP, so hindi ko siya maiwan. I was able to get the results of my mammo and go to my OB only after 1 month. So when I showed this to my OB, she immediately referred me to a surgeon. Sabi ni surgeon, yes, there is abnormal finding in my mammogram, and the best way to evaluate it is through biopsy. He said that the biopsy was recommended by the breast clinic and endorsed by my OB, but it's really up to me if I want it done. He further said that since maliit pa yung mass at hindi pa siya nakakapa, even if he opens my breast, hindi niya yun makikita. It's not visible by the naked eye. So what's going to happen is that what is called the wire-guided biopsy. In-explain niya ako ano yung wire-guided biopsy. Nag-drawing siya. Sabi niya, if this is my breast, it's divided into 4. The left outer quadrant is this part. So, since hindi nga niya makikita, dun sa breast clinic, mag-insert sila ng 2 wire dito para maging guide niya, and then he is going to take this off. Sabi din niya na since the mass is suspicious of malignancy, kung cancer cells na siya, there is a high chance of survival kasi nga parang nag-uumpisa pa lang siya. Pero the best way to evaluate it is through biopsy. So I asked him ano ang kailangan gawin. Sabi niya, I need to get cardiopulmonary clearance to make sure that my heart and my lungs are ready for the operation. So I got that the same day, and then I submitted it to him, and he gave me an admitting order. So when I went home, I told my husband and my son na nag-schedule ako ng operation. Although I don't feel anything abnormal, para lang magkaroon ng peace of mind, para makita ko ano talaga yung abnormal finding na yun. Pero, siyempre, as a typical mom, naisip ko, what came foremost in my mind is that, what? I'm going to be away for 3 days. Who's gonna clean the toilet? Who's gonna do this and do that? ano? As a mom who's been in charge of everything for the past several years, natural lang yun. Pero since there was time, I fixed everything, and then naghanda na ako ng mga dadali namin for yung 3 days in the hospital. Would you believe, nagdala ako ng food for 3 days kasi ang budget, alam mo naman ng mga mom. Sabi ko, since this is not in our budget, kailangan wala tayong very minimal ang expenses natin. So, nagdala ako ng pillow. Meron, yung pillow pala doon, inuuwi na ng pasyente. Nagdala ako ng towel, meron pala doon. Toothpaste, toothbrush, meron pala doon. Tissue, meron pala doon. Hindi ko naman alam kasi the last time na na-hospital ako was several years ago nung nagkaroon ako ng cesarean operation. So anyway, we're ready to go. So the next day, before kami umalis, nag-email lang ako sa mga sisters ko, tsaka sa nephews and nieces, to pray for me. Sabi ko na there's an abnormal finding, blah blah blah, and please pray for me. Si Ernie nag-text din sa mga close friends namin, tapos asking for prayers. So, na-admit ako ng August 31, sa hapon, around 4 o'clock, nag-mass kami dun sa chapel ng hospital. So, this brings me to lesson number 2, pray, 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 pray.